Hello everyone, I'm Dr. Sunil K.S., formerly Professor of Geriatrics at Amrita Institute of Medical Sciences, Kochi. I now practice in Gudalur, a small town in the Nilgiris district of Tamil Nadu, India. Lots of people ask me, what is geriatrics? Why is there a need for such a specialty? What is different about it? Especially when there is general internal medicine for the adults, it might as well be applied to the older individual. Then there are lots of specialties available which cater to different organ systems of an individual, and a person can get almost his complete medical care in these specialties. What is the need for geriatrics? The answer to that is geriatrics has a different approach. No doubt we cater to the medical aspects. A person who comes to a geriatrician with a problem will go through the history taking, physical examination, lab and imaging modalities to diagnose the condition, and he will be treated for the same. But what a geriatrician does differently is that he will also, whenever the situation permits, assess the person as a whole in order to identify problems that can, wherever possible, be rectified in order to improve the quality of life, improve the health, improve the longevity, and make the person's life remaining years better for him. That is the whole focus of geriatrics. How does a geriatrician do this? He does what is known as a comprehensive geriatric assessment. In a comprehensive geriatric assessment, from head to toe, starting with the mind, the brain functions, the mood, the psychological situation with the patient, his sensory functions such as vision, hearing, uh, things like teeth, dentures, all the organ systems are reviewed, and then he formulates what is known as a problem list, lists out all the problems identified, and then he looks at how I can address at least some of these problems in order to make the life of this person, the quality of life of this person, much better. An example, if he has been found to have a slight visual impairment, because visual impairment, both for near vision and distant vision, is tested by the geriatrician. Then he next looks at what is causing it. Very often we find it as something reversible, like a cataract. And then we, along with our ophthalmologist friends, try and get this rectified. Same goes for hearing. Sometimes it is just wax in the ears which is causing the problem. This can be cleaned out with the help of our ENT friends. Sometimes it is sensory neural, where hearing aids may be of use. Similarly, somebody's teeth are missing, he is unable to chew. That will affect his nutrition and overall his health. So we try to correct that with the help of our dentist friends. Similarly, for all the other organ systems. That is what places geriatrics apart from the approach of the general internal medicine. Geriatricians are supposed to know the aging physiology, what happens as people age, how the bodily functions change as a person becomes older. Why? Because these in itself can lead to what are known as geriatric syndromes. For example, falling, tendency to fall down, losing balance, or mood fluctuations, loneliness, depression, dementia, arthritis, incontinence, etc., etc. So these are conditions that are seen more often in the elderly, and these, if identified to a large extent, some kind of help or the other can be provided for the patient. Also, as the physiology changes with age, the way diseases which occur in all the rest of the population, in the older person, the way diseases manifest can be different. The symptoms may be different. So one has to be alert to this possibility in order to pick up the diagnosis. Similarly, the way the person responds to medication would change because of the change in the physiology. So we often have to, use medications in such a way that it doesn't cause more adverse effects. Some of the medicines that are used in younger people are often not used in the geriatric population. And sometimes when we use medications, we have to tailor the dose or lower the dose for the older person. So this is another important aspect where geriatrics um, helps an older individual. Similarly, as people age, they tend to accumulate multiple chronic conditions. For example, diabetes, hypertension, coronary artery disease, prostate problems, etc., etc. And many of these are not curable and they will remain with the patient. So, how do we manage the patient with juggling between all these conditions and optimize the medications in such a way that he is not overloaded with medications, what we call the pill burden? That is also something that a geriatrician looks at. Often we see patients having visited multiple specialties for different problems, carrying around prescriptions from each specialty. And then when we look at these number of medications that the person is taking, we sometimes find there is duplication. Sometimes the medications tend to be interacting with each other adversely. So, as a geriatrician, we try to optimize this, minimize the number of medications that the person needs to take, and this actually enhances the quality of life rather than decreases functionality. Then another issue is, you know, nowadays there's so many treatment modalities available, some of which are invasive treatment modalities. For example, an angioplasty or a coronary artery bypass, etc., etc. As geriatricians, we tend to, uh, we try to help the individual make appropriate medical decisions depending on their age, their general health situation, their wishes, their their role in society. All these factors we try to take into account. What are the number of years remaining for this patient in in uh, in terms of life expectancy? All these things we try to take into account and try and advise the patient to make or help the patient make appropriate medical choices. And particularly towards the end of life, because of so many facilities that and life support systems, etc., that are available today, it is mind boggling, and doctors tend to be very technical when taking these decisions. And as geriatricians, we try and help the patient and the relatives sort out uh, the, you know, what are the available modalities as in, and also take into account what is the condition of the patient. Is it reversible or is it irreversible? And then try and help the patient make the right choice whether to go on these advanced life support systems, etc. So these are some of the ways in which geriatrics helps an older person. I would like in the coming episodes to elaborate on different aspects of geriatrics care. Meanwhile, I would be happy to receive comments, questions, and suggestions on this episode as well as how to go forward. Goodbye for now. Thank you all.